I'm super excited to announce this project that I've been working on. It came out of a need of where I felt really alone. It was the loneliest time of my life when I got diagnosed with breast cancer. The first question I asked my oncologist was, who have you treated that has my exact diagnosis? She couldn't find anyone. This is why I created this platform called Diagnosis Anonymous. Diagnosis Anonymous connects people who are going through cancer, newly diagnosed people, to mentors, people who have been down that same path. Go to diagnosisanonymous.com and join our waitlist to get matched to your mentor. You'll fill out a quick, easy form. You will get notified when you have a match. diagnosisanonymous.com. Thank you. Welcome to Boobalicious. This podcast is about navigating life as a midlife woman. Your health, your body, your identity, and everything that shifts along the way.
From hormones to healing, including life during and after cancer, we're having the conversation no one prepares you for.
I'm Chris, a mom of 2 and a breast cancer survivor.
And I'm in perimenopause.
And we're figuring it out right alongside you.
I'm Jenni, a physical therapist specializing in women's health. Join us and subscribe. Today we have the women of Uncancer. They're incredible for so many reasons, but one, I feel like oral care can be like the redheaded stepchild of our health and wellness plans. So finally, someone is putting their attention to it. And I'd like to welcome Robin, Abida, and Shana. Do you mind each telling us a little bit about yourself? We'll start with Robin and how you came to Uncancer.
Yeah, so I'm Robin Lesser. I've been a practicing pediatric dentist in private practice for over 25 years now. And with my patient population, just how it ties into Uncancer, and I'll let Abida explain more how we started working together. But my patients typically were leukemia patients, so it was a 3-year protocol. And besides that, it was friends and family going through cancer treatment. And we just found that there was this gap where I couldn't always find the products I needed, or learning how to communicate with the oncology team to see, like, do we need blood work? Do we need pre-medication? How often should we see the patient? Can we treat? And with me, it was also a growth and development issue. Like, if we have to take out a baby tooth, when do we jump in? Different things like that. So we felt like there was this huge gap. And through my friendship with Abida, my friendship with Shana, Abida had started with some blogs and asking questions, and we decided that we couldn't really find the products we liked. So we wound up making our own, and we knew that they would work and there would be consistency in ingredients and products, and that they were vetted and tested. And so that's kind of where I came into Uncancer. So it's a very brief version of our journey the last few years. But I'll let everybody else
So in physical therapy school, we learn oncology, but it's not enough. Like I think like new grads don't feel like they are really as equipped as they want to be. Is it similar in dental school?
Exactly the same.
Okay.
Exactly the same. And I feel like you touch on it a little bit with oral medicine, but oral medicine is not a recognized specialty. It's starting to become one now.
Good.
But I feel like it's such a small part of what we do and what we learn, that it was all through education and CE on my own and learning on the job, best way to work through things. So yes, very much the same.
That makes sense.
Well, I'm going to just chime in for a second, because when I went through cancer, I feel like people shy away from dentistry and all the things. It's better. It's almost like, because there's not so much out there and you get scared. So it's like to try to take care of something that you should be taking care of. I just love what you ladies are doing and educating women and kids and people in this area.
And Abida, were you focusing on like head and neck cancers, or how did you come into this world?
So sure. So yes. So, my specialty is cancer imaging, which I've done now for, like 17, 18 years. And before that, I had a PhD and I did a lot of research as well before I went to med school. So sort of always been in this biochemistry and then medicine space. And my husband's an oncologist as well, full disclosure. So a lot of our conversations, even on the dining table or out, was, always about what happened during the day, and this patient came along and this patient was suffering, and what should we do about this? And generally when you get a cancer diagnosis, first of all, it's such a scary thing, right? It really hits you hard. It hits your family hard. And most people, once you get that diagnosis, your main concern is, I want to be alive.
Yeah.
I want to live. I want to hit that 5-year mark and then the 10-year mark, and I want to live. I want to thrive. How do I get there?
Mhm.
And whatever comes your way to get you there, you're willing to accept it. You're saying, this is fine. This is going to be a side effect. I have to live with it. It shouldn't matter. But that's not necessarily true, right? Over the
Yes.
decades, cancer, we're now at a point where treatment has just expanded and exploded by leaps and bounds, right? So we're able to treat cancers based on their molecular profile, very, very specific treatments based on the genetic profile, things like that. On that other side of that spectrum, we're able to diagnose cancers much earlier than what we did before, right? So it's not in today's world, it's not a disease of the old age, right?
Correct.
You
Right.
usually
It's a
like, you
Yeah.
retire,
Yeah.
you're 70, you'd end up with cancer. But now I routinely see patients in their 30s, with rectal cancer and breast cancer and things you would never expect before.
Which is horrible that it's
It is.
hitting us so much earlier. I mean,
It
we're
is.
of a generation. I was 37. I was just like, wow, I'm young. And now it's like you just see people going through it so much earlier, which is a
Absolutely.
little depressing, right?
It's depressing, but on the other hand, we have amazing treatments now. So in so many cancers,
Yeah.
instead of a death sentence, it's sort of like a chronic disease like diabetes. You go
Exactly.
through multiple cycles of recurrence and remission. And if one treatment doesn't work, we can get you on a second treatment and we can get you on a third line treatment. But we have something for you in many, many of the cancers.
Yeah,
The
that's true.
corollary to that, is that while you go through all these treatments, your side effects are getting compounded. Because
course.
any treatment, especially systemic treatment, when we say or chemotherapy, anything other than radiation, affects every cell in your body, right? So some cells, like cancer cells, you want to hit them hard, but the other cells you want to protect them. But unfortunately, it's hard to do that if they are also multiplying like cancer cells. And one of those cell types is the cells in your mucosa or in your mouth.
Oh, and I just want to
Yeah.
I was going to just highlight for a second. That's the same reason why women will lose their hair, right? Because those are
They're growing, right? So the cells in your mucosa, generally every 2 weeks, they renew.
Wow.
So any
Wow.
treatment that you take that hits cells that are growing fast, like cancer cells, hits your oral mucosa as well. And so you may not have head and neck cancer, you may have breast cancer. 60% of the patients will experience some oral side effects. You may have several other types of cancers, but in some way or the other, colon cancer, those are our bread and butter cancers, we say in the cancer field, like breast, lung, prostate. These are the cancers that are most common. And a lot of those patients get oral side effects. But the problem is you say, you know what? I'm alive, this treatment is working, I'll manage this. It'll be okay. I'll figure it out. But if you're going to live for another 40 years after or 50 years after getting your diagnosis, you don't want to live with ththings like that. You want to be able to support your survivorship, and you want to thrive through those years, because many of those years are when you're getting married, when you're having kids,
Oh,
when
yeah.
your
Important
job's
times. Sure.
taking off and you're doing really well there. You have a social life. You want to be able to do the things like everybody else does. But if
And
you're not
it's also interesting too how it feels particular to the cancer world that there's almost a guilt, like, well, I shouldn't complain about these horrible side effects anyone else would complain about because, and that's not fair.
I think people don't talk about it, right?
That's true too, yeah.
They think, okay, this is just what I have, and I'll deal with it, and I'll power through, and
It's what I have to go through to live. Yeah. So definitely.
It's terrible, right? And you shouldn't have that guilt, and you shouldn't have to be thankful just to be alive.
Right.
That's what medicine is there for, to keep you alive and to keep you healthy and to get you out of this state. And physicians are trying to do that, and researchers are trying to do that. And in our world, where Robin and I come from, we met when our kids were together in kindergarten, and that's how we became friends. And so this year, both our daughters, I have graduated from high school. So we've been friends for a very long time.
Me too. Me too. Yeah.
Yay, congratulations. Yeah.
Wow.
Congratulations to you. Mhm.
Yeah, and Robin's a serial entrepreneur, and her brain's always working in that direction. And I was sort of during COVID years, I had a little bit of time because patients weren't coming in as much for scans. Everybody was stuck at home, and so I had some time. And I was thinking, what else can I do? And I'm also at the age where I wanted to think about the next phase of my life. I'm pretty old, and so I wanted to do that. And so one thing I thought, and probably just from talking to my husband, was that there's all these side effects that we don't have standard protocols for to take care, right? Whether it's the oral side effects or more recently, sort of the genitourinary syndrome that comes from cancer and treatments, or patients who enter menopause or are perimenopause, or things like
We talk about that a lot.
Yeah.
and women's health and skin issues that arise, hair issues, your nails, everything gets affected. Anything that grows in your body, it gets affected. And so what can we do about that? And so that's where this journey began. And we were very methodical, and we wanted to make sure that we listen to patients, we listen to caregivers and ask them what we could do. And then Robin, being a dentist, was, so serendipitous that we said, why don't we start in that space?
Yep.
So it took us a while to formulate products and make sure that they're right, and
Of course.
And test
Anything.
them. Mhm.
Yeah.
And then
Yes, that we did.
Shana, how did you get involved with everybody?
Well, actually, I have known Robin since we were in third grade.
Oh, I love that.
We grew up together.
Oh, that's great.
And when she was starting out in her dental career, she was working for another dentist and then decided to open her own practice. And she summoned me to be her office manager, which I have been for almost 19 years now. But at the end of 2016, I was diagnosed with breast cancer.
Okay.
And of course, while I was luckily to be working with a dentist, she was able to walk me through everything that I needed to know and everything I needed to prepare for as I went through my chemotherapy and radiation. And so then when she and Abida started talking about Uncancer, and I said, oh, I have to be a part of this, I started using the products and testing them. And I mean, unbelievable. I just wish that I had them back when I was going through my treatment. But now obviously it's a topic I'm very passionate about. And so I'm happy to be a part of the team I work on partnerships with, nonprofits and working with hospitals and cancer centers to really just help get products into the hands of patients who need them. But one other thing too, just is, getting better communication between oncology and dentistry, because it's really not there. And I can't tell you, just since joining Uncancer, and all the people I've been speaking to have told me that they've been told not to go get dental cleanings during treatment.
I was told that. I remember.
And it's such a shock, and it could be further from the truth. It's so important to go even before you get started. Get a thorough cleaning, get any dental treatment you need to get done ahead of time, extractions, fillings, things like that, because when it becomes during treatment, it makes things that much more difficult to get accomplished. And you want your dental team, you want your dental team communicating with your oncology team so everybody's on the same page, because there's too many people losing teeth, losing bone, having all kinds of oral issues that can really be avoided.
Right. And so I have a question, Robin, if you could start talking us through when some of the side effects, when we talk about treatment, there's different components, right? So I imagine chemo is very different than radiation, or is it? So do you mind kind of talking us through a little bit?
No, it's all very different. So depending even on whether your type of chemo medication, your immunotherapy medication, head and neck radiation, the effects start at different times, depending on where, which treatment you have. Head and neck radiation, that impact can last for a lifetime. People may not totally regain use of their salivary glands. So what we've done is, the American Heart Association and dental community has a very strict protocol. Pre-medication, clearance forms, everything standardized. So what we've done is we've standardized.
For surgery or just for
anything,
heart?
for cleaning, for treatment, just planning based on where somebody is. And so the oncology team and the dental team don't really have that line of communication. So the first thing we want to know as a dentist is, when are you scheduled to start treatment? What kind of treatment are you getting? How many rounds are you getting? At what point can we jump in and do this extraction? If you're in treatment and you have an issue, what's your white blood cell count? What are your platelets at? Do you need pre-medication? There's a whole host of things that come into it. And like we were talking in the beginning, you don't get that education necessarily in dental school. And so
Right.
we're calling the oncology team, they're surprised that we're calling. It's interesting. So we've standardized it form-wise just to make it really easy for people. Depending on the medication, some people can feel an impact after first or second treatment. Some there can be a delay of a few weeks before they start experiencing the oral side effects.
And what are some of those side effects?
So there's mucositis and stomatitis, which are ulcerations of the soft tissue. So sometimes just staying hydrated and using mouth rinses that don't contain alcohol, that don't have a lot of flavoring or
So these would be
menthol
like
or
sores on your gums and inside
soft
your mouth.
tissue. Yeah, like your cheeks, your lips. Dry mouth is huge. So with dry mouth, you also have that. You can lose your inability to talk. Abida, jump in wherever if I'm missing anything.
No,
Dehydration can happen. Also, when your mouth is really dry, it can also lead to sensitivity with your teeth. So sensitive teeth is also one. And then when you have that decrease in saliva flow and your mouth is really dry, you're not bathing your teeth in your natural saliva. So you're actually at an increased risk for decay. So it all kind of snowballs, and all of these work together and can compound and make it worse. So if we can start you on a protocol with your dentist, your oncology team, even if it's just getting fluoride varnish on your teeth every 2 months to help with decay, and also using certain toothpaste like ours has nanohydroxyapatite. So if you have sensitive teeth, you can smear it in and seal it off and try and remineralize. And the salt and soda, our soothing mouth rinse, it's neutralizing. It's an alkaline pH of over 10. So you're reducing that acidity that can lead to more decay. So everything we've done is pretty well thought out to address the main side effects that people see during treatment, especially with our head and neck patients. And some of the new medications that are targeted, like Abida was discussing before, can have a very high incidence of oral side effects, especially the ulcerations.
Now, if I am listening to the podcast and I live in a place where the dentists and my oncologist aren't really communicating,
yes,
can I use Uncancer, and how do I use Uncancer to kind of like educate myself, educate my care team? What would you recommend?
Yes, definitely go to our website.
Okay.
We have an amazing list of checklists that people can use. We call them the stress less checklists. Bring those to your appointments. Has the questions on there, because people seem to, for the most part, are very overwhelmed on diagnosis.
Oh, sure. It's a lot.
And can't think and need something to help guide them through treatment. You can reach out to us. We're available through our help@Uncancer email. You can ask us questions. We can get you information. We can get you those communication forms between your dental and oncology team. Just makes it so much easier for everybody to know what questions they need to ask.
We also have blogs on our website, and they're sort of different than, the blogs you'll see on other websites where it's not what is breast cancer or what, it's not like that. It's okay. So now you have breast cancer and you have premature menopause. What are the effects on your body here? These are practical suggestions of what you can do. You don't know what to eat? Here's what you can eat and what you should eat. And here's why fiber is what is going to help your bowels move if you've had colon cancer surgery. So it's very sort of, through the lens of very practical information that patients or caregivers need, where at 2 a.m. in the morning, you can't call your oncology team, but you'd like to go and get something that you can trust, right? There's a level of credibility.
Sorry, I apologize for interrupting.
Sure,
I was
no
going to
worries.
ask you, Abida, going along that same line of thought. Let's imagine I have breast cancer. I just started chemo. That's broad. Who knows what type I have or what medicines I'm on in this pretend scenario. But what are some things that you would want me to know about my oral health? Things to look out for, things I can do preventatively or proactively?
Yeah. So, first of all, there are so many things that come into play if you get diagnosed with breast cancer. First of all, your age, right?
Okay.
At what age have you gotten it? Your hormone status, whether it's of the cancer itself, or are you in perimenopause? Are you in menopause? Or are you young and you still have your periods? And, how are you situated with that? The third thing is, what is your health status? Do you have other comorbid conditions, right? Are you diabetic? Do you have hypertension? Are you at a healthy weight? There are so many other things. And number four, I think that's really important and doesn't get talked about enough is the kind of support you have.
Sure.
You
Yeah.
have somebody to stand with you as you go through this journey. That's very tough at times. Cancer can be disfiguring. Surgery can make you feel like you are not the same person anymore. Treatments can be tough on your body and tough on your mind. You have emotional distress. So it's very important that you have somebody, and if you're lucky enough to have, a caregiver at home, that's great, but many people don't have that either, right? So I think all of those things matter, especially within breast cancer. We know that 1 in 8 women will have breast cancer.
Right.
So there's always going to be somebody that who has this.
And is there anything specific orally that's kind of just like
Yeah.
general for, you know?
So I think one thing to realize in the oral space is that it's not just the treatment, but also the medications that you're on, right? You will have some level of pain medications. You may have some sleep medications because you're so stressed. You have insomnia and you're not able to sleep. You may have sleep apnea and you're wearing a CPAP machine. So there are a lot of other things that go along with, breast cancer treatment that can cause you to have oral side effects.
That's true.
Right?
Makes sense. Yeah.
Right. So all pain medications or opioids cause dry mouth. That's just a given. So many hypertension medications or blood pressure medications cause dry mouth. So
I
many
take migraine medicines.
yes, it's terrible.
My migraines
Mouth.
make me so thirsty. Yeah.
Right.
Yeah.
So, and medications for depression. A lot of cancer patients are on those medications and all of them cause dry mouth. So,
And what are some what other than dry mouth is annoying to have? Why is it, quote, bad, or why could it harm your mouth?
So your saliva contains minerals and it bathes your teeth. So it's almost like thinking like that's what's keeping your teeth strong and healthy. You're putting those natural minerals back into your tooth structure. And so when you have dry mouth, it's also very neutralizing. So the bacteria that causes decay loves an acidic environment, right? Because it's like a party and it feeds, and that's what makes the holes in your teeth. You can tell in Pete's.
I love it.
But that's what does it. And so when you put that back into your mouth and you stimulate saliva flow and you get that going, you're reducing your risk of decay. Dry teeth actually can lead to more sensitivity. Then your soft tissue gets dry too. So a little scratch in your mouth that isn't going to heal as fast. And then you can wind up with an aphthous ulcer, which is like a secondary infection, can be bacterial within that cut in your mouth. So saliva does an amazing amount of things besides just helping you digest your food, right? Like that's what, as soon as we see food, we start salivating. It helps us digest the food on the way down. So you're not really going to want to eat or drink as much either. So you need to find ways to not only keep it flowing naturally, if you can, like sour candies can stimulate it. Sometimes just chewing, your body senses that and stimulates saliva flow. But if you can't produce it, you need to get it from somewhere.
And also, we have an oral microbiome, right? There's always a balance between the good and bad bacteria in your mouth. And saliva plays a very major role in making sure that balance always exists. Your mouth is chronically dry, like Robin was saying, and the bad bacteria are thriving in that balance is disturbed. And yet you'll see a lot of breast cancer patients complain about not just dry mouth, but they have mouth burning, right? They have mouth burns. My mouth burns. I can't eat, And so much of that is because of dry mouth. You don't have saliva. You have something called pro-inflammatory cascade of cytokines that get triggered. And so you don't see lesions, but you have this chronically terrible feeling in your mouth that a lot of patients will complain. And nobody knows what to do. It's because, we're not addressing the root cause of all of these things, which is, related to treatment.
Wow. And that must be crazy making to experience that and then look in your mouth and be like, I don't see anything, but it hurts.
Yeah, it does. It doesn't. And we don't even realize how much it impacts speech, right? If you have a chronically dry mouth, you can't speak very well. And if you don't speak and you have to be quiet, that makes you depressed as well. So it's just such a cascade of interconnected things. Yeah.
Just to add to what you were saying about, I'm a new patient that just got diagnosed, and what do I need to prepare for? Well, just like you're preparing mentally, you're preparing for support, you're preparing for all these things, you can prepare your mouth for treatment too. And I've heard both Robin and Abida talk to patients and tell them, start doing these things first before you get into treatment. Get your mouth moisturized, keep your lips from getting dry and cracked. Use that special toothpaste to help, make sure your teeth are strong, your enamel is strong. And doing that before starting treatment can help you then get through treatment a bit easier as well.
That is huge. And I would love if one of you could expand upon some of the ways you can do that, because you're like, Shana, to your point, I think a lot of women know from the media or for whatever that they might lose their hair or their fingernails might be involved with chemo. So they know to prepare for that, but no one talks about preparing your mouth.
No.
So that's
the only reason I knew was because of Robin. Otherwise I would have had no idea. So that's why I said before, I just felt so lucky to work for a dentist. So, it's true. You do have to get it ready.
Hi, this is Jenny, jumping right in at the end of part 1 of our episode with Uncancer, the team behind dental care for oncology. I love this episode so much. We just learned so much about the role of saliva. I never even considered it did so many things, so shame on me. But please stay tuned for part 2, which comes out in a week. You're going to learn even more about oral health that you never even knew you didn't know. So essential. Go ahead and hit subscribe to the podcast so you don't miss next week. Thanks.
Thank you for joining us today on Boobalicious. Please don't forget to subscribe, like, and share this with a breastie who needs it. And also, don't forget to support our sponsors. We donate a portion of the proceeds to a charity that supports cancer patients in need. You can find us on Apple Podcasts, Spotify, YouTube, or wherever you get your podcasts. Feel free to DM us on Boobalicious Pod. We welcome all questions and topic suggestions.
The conversations on Boobalicious are based on personal experiences and professional insight, but they are not intended to replace your medical advice. Always consult your doctor or licensed healthcare provider for medical guidance specific to your situation. We're here to support, not prescribe. See you next time.
Bye.
Bye.